Hi, I'm Steve Dale here at the 2009 ACVIM Forum and Canadian VMA Convention, and I'm with Dr. Sam Jones. Dr. Jones is a professor in equine medicine at North Carolina State University, College of Veterinary Medicine, a specialist in large animal medicine, American College of Veterinary Internal Medicine. That is a college of specialists. Explain what that is.
Well, what the ACVIM is it's a organization that oversees the training and certification of veterinarians who specialize in internal medicine in all species. We have several subspecialties within our college, including neurology, oncology, and cardiology, large animal internal medicine, and small animal internal medicine. But the ACVIM is an umbrella organization that brings all of these internists together for educational purposes, for advocacy purposes, and training purposes.
And just like if I go to my physician and my physician hears my heart and says, boy, that heartbeat doesn't sound good to me, and sends me to a cardiologist, the same is true in that there's specialties for veterinary medicine. And let's go through them one at a time. The one that's most known to you is the one you're in, that's
Right.
Large animal. Explain what that is.
Well, I actually specialize solely in equine internal medicine. There are other folks in our large animal internal medicine subspecialty that do both food animals such as cattle and goats and sheep and horses, and then there are those who just do food animals. And the way that it generally works is that a general practitioner in the field will see an animal, a horse, and it will have a complicated medical problem that they can't deal with because they don't have the facilities or resources or training, and they will send it to us in our hospital for that specialized care.
Neurology?
Neurology works generally the same way. A general practitioner will see a case that has a neurologic problem.
Such as?
Such as a spinal cord problem where they become paralyzed, or a problem with the brain where they're seizuring, or they have other brain-related type problems. And it requires specialized care, such as a surgical procedure to relieve a ruptured disc, which happens commonly in small dogs, for example, or advanced diagnostic methods, and of course then also, you know, the training in diagnostic medicine that internists have as well, that leads to their specialty in whatever their subspecialty is.
Oncologist?
Oncologist.
And I think people know that that's a cancer doctor. Same thing in veterinary medicine?
That's exactly the same in veterinary medicine. They specialize in cancers in usually small animals, but not necessarily small animals. An oncologist may see animals that range from cats and dogs all the way up to horses and cattle, depending on their practice situation. In an academic situation, oncologists are more likely to see multiple species than in private practice, where they generally will practice on small animals.
And in setting all this up, I mentioned cardiology. And in fact, one of the specialties is cardiology.
Right. Yes, and it's the same scenario. Cardiologists have that particular expertise that allows them to use advanced diagnostic methods, and then also the expertise to treat and follow long-term cardiac problems in all species.
Lots more information at acvim.org. Thank you, Dr. Jones.
Thanks very much, Steve.